Hi everyone, I'm Yo and this is Virginia. Welcome to our YouTube channel, Knowing, Caring, and Loving Your Lady Parts. So today we have the quick tip series for those on the go with respect to maintaining an optimal postural alignment for your pelvic floor, and of course the benefits of reducing back and neck and shoulder and all those great pains and conditions that are affected by bad posture. So let's get started. If you're new to the channel, please don't forget to hit that subscribe button and let's get started about talking about optimal postural alignment. So to demonstrate optimal postural alignment, we're going to use my new friend Skelly to show you the natural curves of your spine that you want to maintain. So normally you want to have a slight concavity of your cervical spine, your neck area, a slight convex of your upper back or thoracic spine, and then in your lower spine, which is called the lumbar spine, you want to maintain again a concavity or lordosis. So you want to have slight curve in your neck and then in your lower back this way. Okay, so a postural alignment that is optimal would be maintaining these three curves in your spine. You want to avoid being too far forward, which is called kyphosis, because you can't breathe in this pattern. This puts a lot of stress on everywhere else in your back. And then of course, forward head posture, that's really bad for computers, puts a lot of strain in your neck and also affects your pelvic floor because there's a huge connection with respect to your tailbone and also the top of your head with respect to pelvic floor issues. You can't breathe in this position here, and remember, breathing is really important with respect to optimizing the pelvic floor. So you want to think of standing nice and tall, like someone's pulling you by the top of your head and also by the tag of your pants. So that'll create that slight lordosis of your lumbar spine, not this far, but just slightly. And then your ribs want to be slightly over your hips, not too far forward, not back, because then everything shoots forward and that's a lot of pressure on a whole bunch of other areas, especially if you have a prolapse or something low. Okay, maintaining that postural alignment, that'll also encourage a neutral sort of set of your pelvic floor and core muscles to work with a good posture. The ribs also attach to your upper back area, so you want to make sure you're in this good position so your ribs can expand out and you can facilitate your lungs expanding and your diaphragm working optimally with those lady part or pelvic floor muscles. The other tip is too, if you do not sit in or stand and do your KEGELs properly in terms of having your pelvis in a neutral position and it's too far forward or too far back, that will create a malalignment of those muscles. So I want you to sort of just try and sit and then sort of switch in a really slouched position like this. Okay, so your pelvis is in this position here, and that actually is really uncomfortable because it shoots things forward. And if you try to do a KEGEL, which is that in and lift, that'll actually pull more in the back region. But if you sit up straight like this and have that slight curve in your back, that lordosis, that'll encourage you to pull in the anterior part of those lady part muscles, that sling, which is often weaker in most people, especially people who have stress urinary incontinence, and also to support any kind of prolapse anteriorly. Okay, so if you try to squeeze your pelvic floor now, you'll probably feel, or hopefully feel, that you're recruiting the muscles more in the front and not just in the back when you're tilted like that. So thank you everybody for tuning in to this quick tip video about proper postural alignment and how it is important to maintain that important alignment with respect to optimizing your pelvic floor or lady part regions. I would also love to hear your comment about whether you notice a difference when we do a pelvic floor or KEGEL in that position of your pelvis tilted back or forward in the comments below. So please don't forget to hit that subscribe button and tell your friends, and we so look forward to seeing you again soon.